I'm Jim Cocaine. I'm with Pax Medical Supply. We're a durable medical equipment supplier in Cincinnati. Well, in January, a few weeks after the competitive bidding program had started, which we had not won any of the bids, competitive bids, we were not awarded any contracts, I guess I should say. A patient of ours called up. She is an MS patient. She's had a power chair from us for several years, and her chair was not working. It turned out it was just a dead battery, but could we please come out? And we explained to her that we could not, that we were no longer able to come out and provide that service for her. And we had done a lot of different work for her over the years, so she was a long-term customer of ours. So we told her to call 1-800-Medicare, which is what we were instructed to tell people. I happened to be in the office when this call came in, and they said to me, oh, that was somebody else. And we had gotten a couple calls like this. We were getting a lot of them, in fact, at the time. Just 10 minutes later, the phone rang, and they walked in my office and said, Medicare's on the phone about this woman. And I thought, well, wow. So I picked up the phone. She said, well, I have this woman, I think her name was Peggy, on the other line, and why aren't you going out and repairing her chair? And I said, well, we explained to her that we didn't win a contract. She said, well, that doesn't matter, it's a repair. And I said, well, it counts on repairs too. And she said, not if they own the chair, that's only if it's in the first 13 months or whatever it was. And so we said, well, that's not our understanding of this. And she said, no, you're fine to go do this. And I said, well, can you give me your name, which she had given me. I said, can you give me your employee ID number, something so I can reference you? She goes, no, we don't do that. And I said, okay, but I'm just taking your word. She goes, yeah, no, you're fine to do that. And I got off the phone and I said, okay, and I turned to our intake people and I told them this, and they're disagreeing with me, and I was agreeing with them. And so I said, call 1-800-Medicare 3 times. And 3 times asked different people the same question. We did. And 2 people said no, and 1 other person said yes. So we had 4 people, 2 saying yes, you can, 2 saying no, you can't. We went onto the website and we did some searching and found a document that said that a repair can only be done to something like a battery, and it says right in their documents, if it falls down a flight of steps and is damaged. And we were reading this and I thought, oh, what a peculiar way to describe that. But if the chair had fallen down the stairs and then the battery was damaged, then we could replace it, and only under those kind of conditions. So we again called the customer back and explained this to her. She was very friendly. In fact, she was, I think, either an ER or an emergency room, excuse me, an ER or an operating room nurse. So she was familiar with Medicare and the hoops and all that kind of stuff. So we again explained this to her and said, look, we'd love to help you, but we just can't because we're not going to get compensated. So over the next 3 weeks, we were talking to her, and she was calling Medicare, and still 3 weeks later hadn't found anything and was bedridden except for to get up to go to the bathroom. So here she is sitting there, can't get out of her bed except to go to the bathroom, can't move around her home, and all she needs is a battery replaced. So we were talking to her, oh, maybe at least once, if not twice a week. And then in the 3rd week, I get a call from Medicare saying, we have this woman on the phone, why aren't you repairing her chair? And I said, well, I've been through this before, we've talked to you guys. I was on the phone for 41 minutes. I started taking notes at this point, and I kept getting put on hold. And at one point she said, well, now I have my supervisor involved. And another point she said, well, now we have a task force. I never understood what that meant. And I kept saying to her, but we can't. And I read to her this paragraph about the chair falling downstairs. She goes, where'd you get that? I said, we got it off your website. We're off of our website. Well, we had printed it off, so there was a document number there, and I gave her the document number. I said, you got to go look this up. Hold on. I just kept going back and forth. Near the end of the conversation, I said, we would love to go out and fix this. This is a patient we've done a lot of work for, but this is what we're running into all the time. So I'm put on hold. She comes back and she says, okay, we've decided to give you verbal authorization to go do this. And I chuckled and laughed, and I said, you got to be kidding me. I said, if you gave it to me in writing, I don't know if I would go out and do this because I'm never going to get paid for this. And she said, I am just getting so frustrated. And I thought she was upset with me. And I said, look, I'm sorry. I'm just trying to be honest with you and tell you. She goes, no, I'm not upset at you.
Stephanie, is that good?
This is all we're doing is getting calls like this from people who are having these kinds of problems that don't know where to go with it. So, and I said, well, but no, you're not. And she goes, what do you mean? I said, well, you guys keep putting reports out saying there are no problems. We're getting calls all the time from patients and therapists who say we don't know who to send our patients to. Well, call 1-800-Medicare. So we got off the phone. I called the patient, I explained it to her, and she doesn't blame us for this, but she said, well, you know, somebody had said, we're going to get someone out to you. Coincidentally, the next week, there was a webinar, seminar or something that we called into that Medicare was putting on to update Cleveland and Cincinnati, which are two bid areas in Ohio. I think it was put on by our association, OAIMS in Ohio. And this guy from CMS is on there, and he's talking about this. And in the end, you can, towards the end, we're going to take questions. If you want it, you dial a certain number and you speak your name into the thing. And I thought, well, I'm going to ask this question. And sure enough, when he goes, okay, let's go to questions, and they go, the first one up is Jim from Cincinnati, and I thought, oh, great. So I told him this story, and he wanted to talk to me, and would you give me your number? And I said, well, I'm not going to sit here, there's like 80 people on this conference call, so I'm not going to blurt out who I am and what I am. So he said, email me. So I emailed him my contact information. He called me, I don't know if it was later that day or the next day, and we talked, and he was very interested knowing who this gal was that said to me, I'm really frustrated. And I said, no, she's not important. The important thing is we got a patient who still doesn't have a battery in her thing. Now let's get her taken care of. And he said, well, he was more worried about this woman that had said, we're really frustrated here, because he said she shouldn't have told me that. And I said, you know, why are you guys putting out all this stuff? I told him, I said, I am offended when I hear CMS putting out statements that there are no problems out there, when we're getting calls on a weekly basis from therapists, daily actually, from therapists who we had dealt with, who referral sources, who don't know who to go to. We have facilities who have turned away all their referral sources to home health care agencies because they no longer want to deal with the problem because it became such a nuisance to them. At the end of, in the 4th week, I talked to this gal, she said, they came out, they looked at it, they've ordered the parts. I'm hoping to get this thing repaired in the week. So there's a woman who spent 4 weeks in bed because we couldn't go out that same day or the next day and replace her battery. And we're getting these kind of calls all the time. And we're telling people this is what you need to do. You need to be calling your congressman. You need to be actively calling Medicare and complaining to them, because they just can't keep saying that there's not a problem when we're living in this problem. And our patients, the tough thing for us is that a great deal of our patients are elderly people. They're confused on a good day by a lot of this kind of stuff, and the billing and all this goes on. So when we try to explain this to them, they don't understand. And that's because it's hard to understand.
Thank you, Jim.
Okay. You're welcome.